So tell me more about AdhereTech and your product.
Basically, the problem that we're solving is that of medication adherence, arguably the most costly problem in healthcare today. It basically means people don't take their pills, and that's what we're trying to help. Medication non-adherence leads to about $300 billion in increased costs every year, $100 billion in lost revenues. So we created a product. It's essentially a cell phone in a bottle. It sends all patient usage information into the cloud automatically, so we know when the patient used the bottle, how many pills they removed, and we compare that to what they should do, their recommended dosage schedule. Any sort of discrepancy, then we intervene. We do that in two ways. Basically, the bottle lights up and beeps if it's time for them to take their pills, and then if they miss their pills, they get a phone call.
Have you decided on the cost for this yet?
Yes, so the cost at scale will probably be below $50. The price that we're charging, we haven't really decided. One thing we're sure about is that we don't want patients to pay. If you look at like the value chain, who benefits from patients taking their pills, of course patients are up there, but so many other healthcare organizations benefit monetarily as well. So we want them to pay for the product. There's many different business models that we're exploring, but one of our core philosophies is don't change user behavior. So even though the bottle is high tech, it's extremely easy to use. Patients use it like a normal bottle. And we like to extend that even as far as we don't want the patients to pay.
And how did you get the inspiration to make this product?
I've done startups basically my entire professional life. And like any entrepreneur, I kept a list of ideas. Both my parents are in healthcare. Dad's a doctor, mom's an occupational therapist. I was once talking with them about big problems in healthcare, and they sort of opened my eyes to the issue of medication adherence. I wasn't really familiar with it beforehand. This is probably about 5 years ago. So I added to my list of ideas a pill bottle with a Casio watch-like cap on it, something very simple.
How far along are you in the development of this product?
Basically, our trials start in 2 weeks. We have trials with the Walter Reed National Military Medical Center, Cornell University, actually here at Stanford as well, and various hospital systems. So those begin in a few weeks, and then we have a pharma trial with Boehringer Ingelheim beginning in early 2014.
And what is your vision for patients using this smart pill bottle? Are you hoping to eventually have all patients using it for all medications?
We're not trying to be everything to everyone, but we think that we fill a real pressing need for a large percentage of patients. It's really good for patients on fixed dose combination drug therapies, so that tends to be patients on very expensive drugs. And it's also really good for the most crucial drug in a patient's regimen. But this will never be something that all patients use. This is for really important drugs, whether patients have cancer, HIV, transplant meds, discharged from a hospital on certain medication. And we also see a lot of applications in the clinical trial and research space as well.